Hello, Direct Service volunteers. In this series of videos, we will introduce you to some of the most common chronic illnesses that affect the communities we serve. The goal of these videos is to give you a basic understanding of these conditions so you can effectively educate and guide our clients to understand and take charge of their own health. The topic of this video is high blood pressure. For this video, we will be going over the following topics. What is high blood pressure? Symptoms of high blood pressure, regulating blood pressure screenings, and interpreting results. What is high blood pressure? Every time your heart beats, it pushes blood through the blood vessels in your body. Sometimes the force of the blood pushing against the walls of your blood vessels may be higher than normal. If this force or pressure stays high for a long time, you may have high blood pressure, also known as hypertension. High blood pressure can occur when the blood vessels are too stiff, or if they get clogged either from direct causes, such as kidney or heart diseases, or indirect causes, such as smoking or diet. This makes it difficult for your blood to pass through and forces your heart to work harder, which can damage your heart or blood vessels. For many people, high blood pressure doesn't have to cause any symptoms, which is why it's known as a silent killer. However, it can lead to serious health issues such as blood clots, heart attacks, or strokes. Nearly half of American adults have high blood pressure, and many do not know they have it. In Boston, the neighborhoods of Roxbury, Dorchester, and East Boston have higher than average rates of high blood pressure. For East Boston in particular, heart disease hospitalizations and mortality are higher than in any other Boston neighborhood.
It is important to note that high blood pressure disproportionately affects non-Hispanic Black adults, and the prevalence of high blood pressure among Black Americans is among the highest in the world. Theories for why this is the case include higher rates of obesity and diabetes among Black Americans, higher levels of stress from lifetime discrimination, and less access to health information and resources, and so on.
The best way for people to find out if they have high blood pressure is to get their blood pressure checked regularly. At the Family Van, we provide this service free of charge. As high blood pressure is a silent killer, most people do not have symptoms. However, it is still important to be able to recognize potential symptoms so you can help our clients identify when things are serious and when they need to see a doctor right away. Symptoms commonly associated with high blood pressure include headaches, nosebleeds, shortness of breath, fatigue, dizziness, or fainting spells, pain or pressure in the chest, an irregular heartbeat, sudden swelling in the abdomen, ankles, legs, or lungs, or bluish color in the skin. Remember that once a person has symptoms of high blood pressure, it may already be a serious heart threat. If you speak to a client who has a history of high blood pressure and they have some of these symptoms, strongly encourage them to get their blood pressure checked immediately. Regulating blood pressure. A risk factor is something that increases your chance of having a health problem. Some risk factors for high blood pressure are things you cannot control, including heredity, race, age, and other health problems. Risk factors that can be controlled usually include diet, smoking, exercise, or body mass index and stress levels. These controllable risk factors are the ones that can help individuals lower their blood pressure and help keep it in a healthy range. The best approach to lowering blood pressure depends on the person and their circumstances. Common approaches include a combination of the following. 1. Changing your diet to include less alcohol, salt, sweets, fats, and junk foods. 2. Exercising most days, aiming for 30 minutes of exercise per day, 5 days per week. Moving your body in a way that feels good and gets your heart beating a little faster is a great way to manage stress. 3. Maintaining a healthy weight. If you are overweight, losing just a few pounds can make a big difference. 4. If you smoke or vape, try to quit. There are medications and support programs that can help with quitting. 5. Managing stress. This can be hard to address. For some, activities such as meditation and listening to soothing music may be helpful. However, many of our clients face stressful situations regularly, including toxic stress from chronic exposure to racism or poverty that are much more difficult to manage. Work with the client to see what may help them reduce their stress in their daily lives. 6. Taking medication prescribed by your doctor.
Use a combination of these approaches to initiate a discussion with the client on how to best manage their high blood pressure.
Remember that we want to give the client autonomy over their own care. When making suggestions about lifestyle changes, use motivational interviewing techniques. The action plan should be driven by the client. As a reminder, think about foundational motivational interviewing technique skills, ORS. Open-ended questions. Ask questions to which a simple yes or no answer is unlikely to gather information about the client. Affirmative statements. Give compliments and statements of support, encouragement, and understanding to the client as they talk about their challenges. Reflective statements. Reflect back on what you are hearing from the client to demonstrate that you are listening and understanding what they are saying. Summary statements. Periodically summarize what has been covered in the conversation to link together and reinforce topics that were covered.
Further in your training, you will learn more about motivational interviewing and how to apply the skills in your practice. Now, we will do a brief demonstration of how we do blood pressure screenings on the family van. First, ask the client to take a seat if they're not already seated. Introduce yourself and ask if the client is new to the family van or not. If they have been to the family van before, ask for their full name or birthday to look up their client ID in REDCap. If they're new to the family van, add a new client record to REDCap and fill out their basic client information. Add a new blood pressure form for the client in REDCap and then ask the following questions. 1. Have you ever been told that you have high blood pressure? We ask this so we can keep track of whether the client has a history of high blood pressure, and this helps us interpret screening results and also allows us to better advise them on the steps they can take to be healthy. Make sure to mark this down in REDCap. Number 2. Have you had caffeine or tobacco in the last 30 minutes? We ask this because caffeine or tobacco can cause a short but dramatic increase in high blood pressure, even if the person doesn't normally have high blood pressure. This may inform us why someone with no history suddenly has high numbers during a screening. Number 3. Do you take medication for high blood pressure? And if yes, have you taken your medication in the last 24 hours? We ask this because it helps interpret the results of their reading. Also, if someone isn't taking their medication regularly, this question creates the opportunity to educate the client about the importance of taking their medicine as prescribed and to discuss any obstacles they may be facing, for example, cost or side effects. Number 4. How are you feeling? If the client is feeling anxious or excited, this may increase their blood pressure. Wait a few minutes to allow the client to relax before measuring their blood pressure. When ready, briefly explain the procedure to the client. Then make sure that their arm is supported at the level of the heart with their palm facing up and that their feet are firmly placed on the floor. Wrap the blood pressure cuff around the client's upper arm with the cuff's lower edge around 1 inch about the crook of the elbow. Arrange the cuff so the wire goes down along the middle of their arm, palm facing up. Make sure the cuff is not too loose or too tight. Lightly press the stethoscope over the brachial artery, just below the cuff's edge, near the crook of the elbow to find the pulse. Pump and inflate the cuff until the pressure reading is just above 200. Release pressure at a moderate rate and listen for the beating to start. Once this beating starts, note the number on the dial. This first measurement is the systolic pressure. Continue releasing pressure and listen for the beating to stop. Once it stops, note the number on the dial. This is the diastolic pressure. If the subject's pressure is elevated, measure their blood pressure 2 additional times, waiting a few minutes between measurements. Remove the cuff and record the final numbers in the REDCap. If this is the client's first time at the family van, give them a new health information card where they can write down their blood pressure. They can bring this back next time they visit the van and is a reliable way of monitoring their blood pressure levels.
Interpreting results. Being able to interpret the results of a blood pressure screening will allow you to appropriately respond to your client's questions and help them better understand their own health and what next steps you might recommend for them to take. Blood pressure is represented by 2 numbers. The first is the systolic blood pressure, which indicates how much pressure your blood is exerting on blood vessels when your heart beats. The second is diastolic blood pressure, which indicates how much pressure your blood is exerting between heartbeats. Typically, we pay more attention to the systolic blood pressure, but both can be used to diagnose high blood pressure. Blood pressure values can range from normal to severe. A measurement less than 120/80 is considered normal. If a client has this blood pressure, you can suggest that they stick to their current habits and check in again within 1 year. If their systolic blood pressure is between 120 and 129, and their diastolic blood pressure is less than 80, the client has an elevated blood pressure. This is not considered high blood pressure yet, but they may be at risk for developing high blood pressure. Suggest that they check in again more frequently or visit a doctor to talk about their elevated blood pressure. If their systolic pressure is between 130 and 180 and their diastolic blood pressure is greater than 80, recommend that the client engage in lifestyle changes and encourage them to speak with their doctor about receiving blood pressure medication. If they're already on medication, reinforce that they should continue using them as prescribed. If their systolic pressure is greater than 180 and their diastolic pressure is greater than 120, the client may be in serious hypertensive crisis. To confirm, let the client rest for a few minutes and then retest 2 more times. You may want to ask another member of staff to confirm as well. If numbers remain high, remain calm, do not alarm the client, and contact a staff member. They may refer the client to the nearest emergency room or, with the client's permission, call their physician to see what they would like the client to do. For more information about blood pressure, you can refer to the volunteer training manual or talk to your shift supervisor or family van staff if you have any questions.